All right, so you think your child may be having night terrors. What do you do? First of all, distinguish it from nightmares. There's a previous video that helps you distinguish nightmare from a night terror. If your child is having a night terror, there are a couple of things to keep in mind. First, it's common, and children do tend to outgrow it. So safety is the key, first and foremost. Making sure that during a night terror, they are safe. There are no things in their room that could hurt them, like sharp corners or things that they might be able to pull down. You just want to make sure overall safety is put in place during these events. How do we get rid of them? Well, there are a couple of strategies. Because night terrors occur out of deep sleep, it's very important that the child is not sleep deprived because you're much more likely to have a night terror if you're sleep deprived. So getting great quality and quantity of sleep is our first priority. Second, because night terrors often occur due to an arousal or a partial arousal out of deep sleep, you want to make sure that the environment is otherwise quiet overall and there's no sudden noises that could be waking them up. For example, a police siren going in the street, or a phone in the room that's going off. All of those things can actually trigger a night terror. Next, we're also going to screen for internal issues that could be causing partial awakening. So, for example, children that have eczema and they're waking up because they feel itchy. Children that have reflux, sleep apnea. These are all potential internal factors that could be causing partial arousals and leading into a night terror. Again, they're usually not the case. Most of the times there is no clear trigger, but these are things that I typically screen for. Now, if all those things look okay, sometimes for my patients, I'll recommend a technique known as scheduled awakenings. Now, this is not medical advice. Definitely discuss with your pediatrician if this is right for you. But what I do is, if a child is having night terrors frequently, and they're occurring around the same time of night every single night, I have them wake the child up about 20-30 minutes prior to a typical episode. I wake them up enough such that they can tell you their name and then go back to sleep. And I do this for 3 weeks straight. And for some reason, that tends to reset the brain and night terrors go away. So that's a technique that can be tried, again, if it's okay with you and your pediatrician. It's called scheduled awakenings for night terrors. It's a non-medication approach to helping with the problem. But again, rest assured that most children will grow out of it over time, and just make sure that the environment is safe for them in the event they have a night terror. Don't try to wake them up from a night terror. That can sometimes prolong it and they might wake up rather scared or confused. Try to guide them back to bed gently and slowly. All right, hope that's a helpful review for night terrors. Take care.